Good evening, I'm Michelle Robertson. Thanks for being with us. As the Obama administration works towards finding a way to fund the public health insurance option, one Wyoming woman is speaking out. Joanna Shuck is an MS patient from Osage, Wyoming. She says that the use of an MRI has been a great help in her treatments. In order to fund universal health care, the Obama administration might cut Medicaid funding for procedures like medical imaging. Shuck flew to D.C. this week to try to convince lawmakers to vote against the medical imaging cutbacks.
The president is spending much of his time and major political capital explaining health reform over and over.
Nobody is talking about some government takeover of health care. If you like your doctor or health care provider, you will be able to keep your doctor, period.
Yet multiple polls show the public is confused. Many don't get what's in it for them, even those who came to hear the president speak this week.
Have you been paying attention to the health care debate?
I've been picking up bits and pieces here and there. But 1,000 pages, I think, is a lot for anyone to go through.
That's 1,000 pages for just one of 3 different versions of the House bill. There's also a Senate version out there. The House is left for its break while senators are working nonstop through their last week. Senator Kent Conrad even brought his dog to work. He admits it's hard to sell the public on a deal that isn't yet done.
You've not seen a bipartisan package yet be presented to the American people, and when it is, then we have to do a massive job of education.
But it will be autumn before both houses of Congress return to work on that hoped-for combined package. In the meantime, health reform opponents are capitalizing on the confusion.
Tell Congress you've been squeezed enough.
But do you trust Washington with your life?
GOP opponents have warned senior citizens that they believe Medicare will be slashed.
There will be rationing of health care, and many people won't be able to get a hip replacement.
In response, House Speaker Nancy Pelosi sent representatives back home with tools to counterattack, a point-by-point memo to educate voters on the bill's goals, though again, there are few specifics. No discrimination for pre-existing conditions, no dropping your coverage because you become sick.
We intend to set the record straight. In some places by inoculating against their misrepresentations, in all places by educating as to what this legislation does.
The president praised the House's progress, even though it missed the August deadline for a full bill. Congressional Democrats say they plan to use this delay as a virtue by telling the public they're taking the time to make sure the right things are in this bill and that the public understands it. Kimberly Dozier, CBS News, the White House.